For most of human history, 1 in every 100 women who gave birth did not survive it. Not from disease, not from war, just from the ordinary act of having a child. And every woman who climbed onto that bed knew the odds going in. Let's put you there. A small bedroom sometime in the early 1800s. No hospital, no doctor on the way. Just you, a midwife you've known your whole life, and a labor that started 12 hours ago and shows no sign of ending. There is no medicine in this room that will actually stop the pain. There is no clock ticking toward relief. There is only time, and the belief, shared by everyone in the room, that this is simply what bringing a child into the world costs. Here's what almost nobody talks about. Childbirth wasn't a rare medical emergency in the pre-modern world. It was one of the single most dangerous things a woman could do, and she was expected to do it again and again. Historians estimate that a woman in early modern Europe or colonial America had roughly a 1 in 8 chance of eventually dying in childbirth if she gave birth throughout her reproductive life. Not a 1 in 8 chance per birth, a 1 in 8 chance across a lifetime of them, because most women had 5, 6, 7 children or more. The midwife in the room isn't a professional in the way you'd imagine one today. She's usually an older woman from the community, trained entirely through experience, her own births, and every birth she's ever assisted. She has no formal medical training because formal medical training doesn't include this. For most of history, medicine was practiced almost exclusively by men, and men were not present in the birthing room. This was considered women's work, hidden from the rest of the household, sometimes behind a literal curtain hung across a corner of a room. So what actually went wrong, and how often? The complications that kill women in childbirth today, hemorrhage, infection, obstructed labor, are the exact same ones that killed them then. The difference is what existed to stop them. Take hemorrhage. If a woman began bleeding heavily after birth, there was no way to replace the blood she was losing. No transfusion, no way to even measure how much danger she was actually in until it was often too late. Midwives developed techniques to manage it: pressure, positioning, herbal preparations believed to help the uterus contract. But against a serious hemorrhage, there was very little anyone could do but watch. Infection was worse, and it was almost invisible until it wasn't. A fever a few days after birth, sometimes called childbed fever, was so common and so often fatal that it became one of the most feared complications in medicine. Nobody understood why it happened. The truth, discovered far too late for the women who died from it, was horrifying in its simplicity. Doctors and midwives were carrying infection on their own hands, from one patient to the next without ever knowing it. This is where a Hungarian doctor named Ignaz Semmelweis enters the story. And if his name sounds familiar, it should. In 1847, working in a Vienna maternity hospital, Semmelweis noticed something disturbing. Women delivered by doctors and medical students were dying of childbed fever at nearly 3 times the rate of women delivered by midwives in the ward next door. The doctors, it turned out, were coming straight from performing autopsies to delivering babies, without washing their hands in between. Semmelweis ordered hand washing with a chlorinated solution before every delivery. The death rate in his ward dropped by more than 90% almost immediately. It was one of the most significant medical discoveries of the century, and the medical establishment rejected it completely. The idea that a gentleman's hands could carry disease was considered an insult. Semmelweis was ridiculed, pushed out of his position, and died in an asylum in 1865 from an infected wound. Killed, in a horrible irony, by the exact thing he had spent his career trying to warn everyone about. Basic hand hygiene in childbirth wasn't widely accepted for decades after his death. Then there was obstructed labor, the complication with no good options at all. If a baby couldn't pass through the birth canal, there was no cesarean section as you understand it. Surgery on a living woman's abdomen before anesthesia and before any real understanding of infection was almost always fatal to the mother. It was performed only as an absolute last resort, usually only after the mother had already died, in a desperate attempt to save the child. Labor that went on too long with no way to intervene is one of the darkest and least discussed causes of maternal death across almost the entirety of human history. And there was almost nothing for the pain. Women in labor were given whatever the era had on hand: herbal preparations, alcohol, sometimes opium if it was available and if anyone thought to offer it, but nothing that touched the intensity of what was actually happening. In some places and eras, pain during childbirth wasn't just untreated, it was considered morally appropriate. Religious teachings in parts of Europe framed labor pain as a deserved consequence, something a woman was meant to endure rather than escape. That belief held on with surprising strength even after real pain relief became medically possible. In 1847, the same year Semmelweis made his discovery, a Scottish physician named James Young Simpson successfully used chloroform to ease the pain of childbirth. It worked, and many religious leaders and physicians opposed it anyway, arguing that labor pain was ordained and that removing it was interfering with something it wasn't humanity's place to interfere with. The objections held for years. Then, in 1853, Queen Victoria used chloroform during the delivery of her 8th child, and the argument mostly ended overnight. If the pain relief was acceptable for the Queen of England, it was acceptable for everyone. So what actually changed? 3 things. Arriving over roughly a century, transformed childbirth from a genuine gamble into something closer to routine. Antiseptic technique, championed by Semmelweis and later validated and expanded by figures like Joseph Lister, finally brought infection rates down once hand hygiene and sterilization were taken seriously. Safe, effective pain relief through anesthesia gave women an option that had never existed before. And eventually, safe surgical intervention, a cesarean section that a woman could actually survive, turned obstructed labor from a near-certain death sentence into a solvable problem. By the early 20th century, maternal mortality in wealthy countries had already started falling. By the mid-20th century, with antibiotics added to the picture to finally treat infection directly instead of just trying to prevent it, the numbers collapsed. What had once carried odds measured in single digits over a lifetime dropped to a fraction of a percent per birth. Today, in a well-equipped hospital, a hemorrhage gets a transfusion within minutes. An infection gets antibiotics before it ever becomes a fever anyone has to fear. And obstructed labor becomes a scheduled surgery, not a death sentence. The birthing room isn't hidden behind a curtain anymore. It's one of the most closely monitored places in modern medicine. The woman in that early 1800s bedroom didn't have any of this. She had a midwife with decades of practical experience and absolutely nothing to offer against a serious hemorrhage. She had a 1 in 8 lifetime chance of paying for motherhood with her own life, and she almost certainly knew someone, a sister, a mother, a neighbor, who already had. And she went through with it anyway. Not because she didn't understand the danger, but because there was no alternative that didn't involve the same risk in a different form. Every single person alive today exists because a woman somewhere, at some point, accepted those odds. You'll likely never meet anyone who died the way millions of women once did, quietly, in a bedroom, from a complication that today gets treated before lunch. That fact is so completely normal to you that it barely registers. It was the single greatest fear of half the population for most of human history, and now it's a Tuesday afternoon in a hospital, with a lot of people in the room and almost nothing left to fear.